Good afternoon and welcome to the fourth webinar of the year in the Tobacco Control Program webinar series. This is Alexis Bailey with the Emory Centers for Public Health Training and Technical Assistance, and I'll be your moderator for today's webinar. Today's webinar will focus on working with people of low socioeconomic status, one of our priority populations. As a reminder, South Dakota's 2020 to 2025 Tobacco Control State Plan goals include prevent initiation, promote cessation, eliminate exposure to tobacco, and achieve health equity. Today's webinar connects to all four goal areas as people of low socioeconomic status were identified as a priority population in the state plan. Here's a friendly reminder of some of our housekeeping and ground rules for today's webinar. Please be sure to mute your audio. Cameras will remain off. We will have time for questions at the end of today's webinar, but please feel free to put questions in the chat box at any time. Please be sure to participate in any of the interactive portions of the webinar today. Also, a quick reminder that this webinar can be counted for continuing education credits. And finally, this webinar is being recorded and the webinar recording will be available later on. There may be times throughout the webinar when you'll want to provide feedback. One way to do that is by using reactions. In the black Zoom toolbar, you'll see an icon that says reactions. Click on that and a box will pop up with a few reactions to choose from. You can see more reaction options by clicking the three dots in the upper right corner of the box. And you can scroll through the list or search using the search bar. We will also be using Poll Everywhere on today's call to answer a few questions. We'll take some time now for everyone to log into the platform. So please go ahead to pollev.com/AlexisBailey790, or you can text Alexis Bailey 790 to the number 22333 to join our group. I'll give everyone a minute now to go ahead and log in, and then we can practice with our first poll question. And note that these login instructions are also in the chat box in case you need them again. And let us know if you're having any trouble logging in. The text option is pretty easy if you just want to use your phone. If you want to give us a thumbs up if you're logged in, we can move on when you're ready. Looks like most people are about there. These text options these instructions will live in the toolbox and they'll also be available on the next screen. So if you are taking a little bit longer, please be aware that they'll still be accessible for you. So we'll go ahead and go to our first poll. We want to know what your favorite winter activity is, and you can go ahead and text or type your response in and it will populate on the screen. Love it. See some snowball fights, Christmas movies. Take another minute here if you want to go ahead and answer. Thank you all so much. I'm loving your responses. These all sound like great winter activities, and hopefully you guys are doing some of those soon. Please note that when we use the term tobacco on today's webinar, tobacco refers to commercially produced tobacco products only, and never the traditional tobacco of our Northern Plain American Indians. After today's webinar, we hope you'll walk away knowing more about working with the low SES population, the barriers they may face to receiving services, and how that relates to your work. Today's presenter is Casey Redden. Casey holds the Tobacco Disparities Coordinator position for the South Dakota Tobacco Control Program. Casey attended the University of South Dakota, in which she successfully completed both her master's in addiction counseling and master's in social work degrees. Casey is a licensed addiction counselor and licensed certified social worker in the state of South Dakota. She has a background with serving a wide variety of populations, including adolescents and adults within both the prevention and treatment facets of the addiction field, along with experiencing and mending family relationships through counseling services. Casey has a passion for helping people and creating opportunities to alleviate the burdens that perpetuate health disparities. Welcome, Casey. Now I think we have a few poll questions to get started. Again, you can use your poll everywhere and go ahead and start responding to these. These are some responses already on the screen. Looks like most people have responded. All right, we'll check this response now. If you answered B, you were correct. Next poll. And if you're having any trouble voting, you can just type your responses right into the chat box. Great, let's see what this one was. If you answered more, you were correct. Thanks so much. All right, true. All right, let's check this one. Looks like 43% is correct. Last question. All right, looks like most people have responded, and that answer was all of the above. I'll hand things over to Casey to continue with our introduction.
Wonderful, thank you, Alexis. So just to start out this webinar, we're going to talk about the down low, about low socioeconomic status. So this is a combination of education and income and occupation as well. Socioeconomic, the individuals with less than a high school education have higher incidence of lung cancer than those with a college education, and individuals with a family income of less than $12,500 have a higher incidence of lung cancer with family incomes compared to the $50,000 or more. Those living in rural areas have 18 to 20% higher rates of lung cancer than those in urban areas. South Dakota's with the lower income use of tobacco at higher rates than the general population. The tobacco industry increases advertising in low income areas, so community members face more exposure to tobacco marketing. Lower income populations have less access to healthcare, making it more likely that they are diagnosed at a later stage of disease and condition. 12.2% of South Dakotans are without health insurance under the age of 65. Next slide, please. Why is this a priority population? So people living in poverty smoke cigarettes for a duration of nearly twice as many years as people with family income of 3 times the poverty rate. The poverty rate in South Dakota is 11.9%. The lowest rate of poverty in the US is 7.5%, which is in New Hampshire, and the highest being in Mississippi at 19.5%. The national average is 12.3%. So we are just around that national average. The use of tobacco among this population is 43.2%, which is almost double the rate of the general population at 23.6%. Tobacco users with Medicaid had significantly lower quit rates at 32%, compared to those that have other insurance types, which their rate was at 39.5%. Next slide, please. So with this population, there are some myths that are associated. And so we're going to do a couple of the myths and the reality for that. So one myth is poor people are unmotivated and have weak work ethics. In fact, the severe shortage of minimum wage jobs means that many poor adults must work 2, 3, or 4 jobs. According to the Economic Policy Institute, poor working adults spend more hours working each week than their wealthier counterparts. Next slide. Another myth is that poor people tend to abuse drugs and alcohol. The reality is that although drug sales are more visible in poor neighborhoods, drug use is equally distributed across poor, middle class, and wealthy communities. Addiction knows no boundaries. Next slide. So today we are going to do a spent activity, and this is not specific to South Dakota, but it will give an idea of what an individual within the low socioeconomic status population is challenged with on a daily basis. We will be splitting up into break rooms of 4 or 5 people in each room, and we'll be asking you to make decisions together throughout this activity. We suggest having one volunteer who will talk through the options presented. There will be one tobacco prevention coordinator in each break room, and that will be there to assist you. We hope this activity will give an idea of the decisions of someone within the low socioeconomic status population. We will then come back together for a little reflection and discussion, and any other questions or concerns about this activity that we can answer at that time. But before we get started, are there any questions? All right, I don't see any questions, and so we will head to our break rooms.
For those remaining, you can go ahead and join your breakout rooms. There should be a prompt for you on the screen.
Hey, we're not able to share our screens in the rooms.
Really?
It says it was disabled, or at least I'm not able to. I guess I don't know about the others.
Okay, I just put multiple participants can share, so hopefully that fixes it. Otherwise, maybe have
Okay,
everyone pull it up, and you'll just talk through it.
I'll try again.
Sorry, thank you.
Hello. So we are just waiting for everyone to get back. And Alexis, is everyone back in the group?
Yep, it looks like everyone has returned.
All right. Did you guys get through the actual whole activity, or did you get cut off early?
We got through the,
I was just gonna say, my group, this is Ashley, we did not make it all the way through our activity, but we were close.
This is Hillary. We made it through with a few minutes to spare.
Okay.
we didn't get through all the questions though.
Yeah, this is Joan. We got to day 12 on the game and then through most of the questions.
All right. So what was kind of the feedback of the group? So when you're going through the activities, what were some of the challenges or barriers that you noticed?
So this is Joan. This is our group kind of talked a lot about, like, you know, even though, okay, suppose you got in a car accident and you hit somebody, do you pay, you know, the deductible for insurance, or do you drive off? Well, you know, you want to do the right thing and you want to be, you know, report it and pay for the damage. But on the other hand, you have kids to feed. And sometimes the wrong choice is the one that you have to make.
Thanks, Joan. Anybody else notice any challenges or barriers other than that one?
Casey, this is Fran. And I think one of the biggest barriers was that this wasn't like a full poverty simulation where we know more details about our family and about the community that we're living in.
Thanks, Fran. Yeah, that's a good thought. We didn't know exactly where we were living at or things like that. And that was kind of brought up in one of our groups of, they said like, oh, the bus is free. Well, not knowing where we're at, it might not be free. Have you guys noticed any of these barriers in your own communities?
You know, Casey, it was hard. This is Sandy with the Teddy Bear Den, and it was hard for me to make some decisions because I could see some of our moms and the things that they go through and the choices they have to make. And so I felt like I struggled with some of those decisions. I know inside what I would do, but I also know the side that some of my moms would take.
Thank you, Sandy. That's a very good perspective. Any other thoughts on that or seen things in their own community?
This is Kendra Krieger with the American Cancer Society Cancer Action Network. And Casey, with a lot of conversations that I've been having with folks as we lead into Medicaid expansion work in 2022, there are a lot of folks that are making those decisions on, is it rent or medication in full? Even with, you know, additional resources from hospital systems or manufacturers of different prescriptions or discount programs through like Walmart, they're still struggling because they may have a disability or some other unintentioned life circumstance that's faced them, that they're now having to make those tough decisions between, you know, food for their family or, you know, going to the hospital because they know something's wrong.
Thank you, Kendra. All right, we will move on to a scenario discussion now. So the scenario is your coalition hosts an informational meeting about tobacco cessation every other Friday at 3 p.m. at the public library located in the center of town. Participants who attend receive free quick kits information about the South Dakota Quit Line, and can access online resources through the library's free internet. 10 people attended the first event, but you've noticed attendance keeps declining with each meeting, and only 2 people attended your last event. What are some barriers that might be preventing people of low SES from participating? And also, how might your coalition help address those barriers? So you can either come off mute or you can type it in the chat. And Taylor says not able to miss work, not able to find childcare. The time of the meeting, so 3 p.m. Any other barriers? Transportation to the meetings. Running to too many other events, that definitely could be it as well. The interest, thank you, Fran. Joan, work, yep. So how might we address those barriers that we've thrown out there? So they might have slipped and started tobacco again and feel that they cannot restart their tobacco-free lifestyle. Yep, shame is definitely a reason why people don't attend things any longer, because they don't feel like they can take that shame of, well, I wasn't successful. Kendra feeling they missed out on one, so they can't attend more of the meetings. Very true. Sabrina said, offer Zoom meetings or calls to follow up on meetings. That's a great idea. Fran, better incentives. Incentives do bring people in, but it's also important to not have only incentives, because then sometimes people just show up for those, but yes. Line up volunteers to watch children, volunteers to transport individuals to and from meetings. That's a very good idea. Especially the childcare thing. If that is the largest barrier they have, then it definitely helps. Tracy says, we have found that having a Zoom meeting option is helpful for people to still stay connected and send email minutes out. Very good idea, Tracy. I think even on my side of things, being able to attend Zoom meetings has opened up my availability for being at the meetings that I need to be at. Wonderful. And we'll go to the next scenario then. All right, scenario number 2. Rachel is a high school student and is caught using a Juul on school property. This was her 3rd strike, and the school suspended her for 1 week. Rachel relies on the school bus for transportation. So when she is suspended from school, she can no longer make it to her after-school job and loses that week's income. She also does not have the access to free lunch, which she receives at school. When she returns to school, Rachel's teacher notices she is behind in all of her classes and is obviously stressed. Rachel is obviously struggling not to use her Juul in school as well. What are some challenges that Rachel faces due to her suspension? And you can type this in the chat box if you would like. Falling even more behind in class or dropping out completely. Taylor, as listed, loss in income, behind in school, not getting adequate nutrition, being stressed and getting more behind, shame, no lunch. Also, I don't know if anyone got the part of like, do you choose smoking or not smoking? The group that I was observing said they weren't going to smoke, but we do know that people start smoking because of high stress situations. And when you already have started using a nicotine product, your body kind of jumps into that more stress in your life because you're going through withdrawal as well. increased stress with school and time. And what are some supports that Rachel would benefit from? Any thoughts on some things that she would benefit from?
So something that I think is kind of like outside the box, not necessarily with the tobacco, but we see like she doesn't have access to the free lunch, figuring out maybe helping her get additional resources on food security or like the backpack program. I don't know if they do that for high schoolers, but something along those lines, because obviously that leads to some of her stress.
Yeah, thank you, Tino.
This is Joan. I think instead of maybe the suspension, maybe the after school a curriculum of sensation and tobacco.
Yep, that's a great idea. So instead of being suspended, the policy could be that they attend some cessation intervention of like counseling or the in-depth curriculum. Taylor said help with homework so she can get caught up. Fran said a friend or counselor that recognizes her current situation, that she needs help. Yep. Any other things that might help her? All right, we will move on to our reflection here now. So how might you or have you helped address barriers in your tobacco control work with members of the community who have lower incomes? Connect them with resources. Jordan, what kind of resources are you referring to? Fran said talk to them to see what their needs are and what direction they would like to take. Joan said provide quick kits to WIC, Horizon Health, and dental offices, as well as the contact center in Yankton.
Casey, this is Joan. I think it's really important just to remember like where these people are, would they, to take the resources to them, may it be a food pantry, may it be school, you got to meet them where they're at.
Yes, that is a great suggestion, Joan. Taylor said, ask them what their main barriers are. And so you are actually aware of what the greatest needs are and can make a solid plan on how to truly help them. Sabrina, we partner with a food bank to help them out that way. And we hand out brochures monthly as educational issues. Yes, very good. Also, kind of some suggestions as well as thinking of maybe your hours of the day that you're open. Like Joan said, meeting them where they're at, not really having them work around your schedule. So being aware of like transportation, hours of being open, maybe are you providing incentives that would benefit them? I believe, well, Sandy with the Teddy Bear Den would have bus ticket incentives. So purchasing bus tickets to allow them to come back and forth from the Teddy Bear Den. Sabrina said, we also get snacks from Feeding South Dakota and have them in her office. at the school. So when the students come in, they get a treat. I can talk to them about their issues. Seems like the only ones that stop are in the students that use substances. Okay. And Kendra said, educating decision makers on the needs of ongoing tobacco prevention dollars. Yes. And being aware with some of those different programs that are in your community, maybe you could work with them on having like activities or things that you can work on for that population too. So, you know, even serving at the food banquet or having a fundraiser where you get canned food that can go out to those individuals, especially in smaller areas, kind of helping alleviate some of those barriers that they might go through. Because if it comes down to using the bus ticket to go to work or to go to your organization, they might be choosing go to work. Or if they have to go pick up their kids and they don't have time to stop before it closes, then they lose out on that as well. All right. Great conversation. So we can move to the last slide.
Thank you, Casey, and for everyone else for participating today. As always, we ask that you fill out the survey in the chat box so we can continue to improve the webinar series. And thank you again for joining us, and we hope you have a great rest of the day.